All right. Good afternoon, Janifa and Judy. Welcome to our to MWM webinars. Today's topic is asthma, and we have our guest speaker, Dr. Saksham Kandel. So he will be giving the he will be the speaker for today. So, Doctor, uh, the floor is yours.
Okay, thank you for the introduction. And my name is Saksham Kadel, and I have done my MBBS from Nepal, and currently I'm in the UK, and I have been registered with GMC and with the license to practice. Today I'll be talking about asthma. So, before moving on, I'll share my slides. So, just give me 1 minute. Yeah, I think everyone is able to view the slides now. Okay, so all right. So at first, let's talk what asthma is, then we will proceed further. So at first, asthma is most of us know that it is a condition that affects our breathing. And the second thing is it is a type of allergic reaction. So what from this two statement, what we can establish is that asthma it is a type of allergic reaction that affects our airway, and that will leads to difficulty in breathing. So, symptom of asthma, most common symptoms of asthma are tightness, wheezing, shortness of breath, like that. But the reason behind all of these symptoms are because there is allergic reaction, there is inflammation and muscle tightening around the airways, which leads to narrowing of the airways, and thus the symptoms like shortness of breath, chest tightness, cough, like these symptoms. So that is a reason behind the symptoms of asthma. So the other thing that we need to know about asthma is it is a chronic condition. It is a condition that cannot be cured, but we can manage the symptoms, like I have mentioned before. So sorry. It is a chronic condition. It is a lifelong condition. So it need long-term management. So we need to be aware while treating the patient with asthma. Now, let's talk about some of the common symptoms of asthma. I have already mentioned some of them, and we have already discussed the reason behind those symptoms. So, as I mentioned earlier, it is because of the narrowing of the airway, which makes it difficult for the person to breathe. So, some of the common symptoms are persistent coughing, especially at night. Other are wheezing, shortness of breath, chest tightness. These are the common symptoms of the asthma. Okay. Now, let's talk about the burden of asthma. How many persons are affected, and what is the burden worldwide? All right. So, asthma, it can affect people of all ages, although younger people are affected more than the older people, but it can affect the people of all ages and all gender. Basically, it can affect anyone. So, according to the World Health Organization, it currently affect around 339 million people worldwide. And there was a survey done in England back in 2018 where the people have self-reported asthma diagnosis. And according to that survey, 17% of the men and 18% of the women they were diagnosed with asthma once in their lifetime. So it is pretty huge number. And again, up to 5.4 million people here in the UK is receiving treatment for asthma. So looking to all of this number, we can say that it is pretty huge problem and it is a common problem, right? So now I'm going to talk about few of the common triggers of asthma symptoms. As I have mentioned earlier, that asthma it is an allergic reaction. So as with all other allergic reaction, there are some triggers for asthma symptoms. So before knowing about the common triggers, we need to understand that every individual have different triggers. So it is very important for individuals to find out their own triggers and try to avoid those triggers if they can. So as I mentioned, triggers can be different for different individual, and it is very important for individual to identify their own triggers of the symptoms. But some of the common triggers are change in weather, dust, smokes, pollen, animal farts, and feathers, and strong smell. So, in my experience, I don't have long career in medicine, but as far as I know, change in weather is by far the most common symptoms of asthma. So, if you are working in an accident and emergency department, you can expect asthma patient during the winter season. It is the season where most of the symptoms are triggered, and most of the patient have asthma attack. So, but there are other triggers as well. So, but change in weather, it is the most common triggers. All right. Now, let's discuss about how to diagnose asthma. As with any other patient, when patient comes to you, we have to do some assessment so that we can diagnose the disease, right? So first we have to do initial assessment. How we do that is by taking a clinical history. History again is very important to take. We have to take history regarding the symptoms of asthma, any triggers they have, any personal history of any other allergy, and any other family history of asthma. So, as I have told earlier, that asthma is an allergic reaction. Most of the time is coexist with all other allergic disease like eczema and other. So we have to ask patient whether they have allergy history of other allergy or not, and it tends to run in family, so we have to ask whether they have any family history of asthma as well or not. Then we have to examine the patient. While examining the patient, we have to look for any sign of respiratory distress, wheeze on chest auscultation. uh, so, uh, I'll tell you why clinical taking history is very important, because these are the sign we can look out. The signs that I mentioned here, these are the sign we can look out in physical examination, but they are not always present. They may be absent. So, if these signs are not present, it does not rule out the asthma. So we have to take a very detailed history. If patient know about any triggers, what they feel during the asthma attack, and when they have those symptoms, we have to take very thoroughly, because this finding, physical finding, can be absent when we are doing the examination. All right. So yeah, this is the same thing that I have mentioned. And after doing physical examination, we have to do some test to diagnose asthma. Some of the test includes eosinophil count, fractional exhaled nitric oxide, bronchodilator reversibility, peak expiratory flow diary for 2 weeks, bronchial challenge test, and skin prick test. I'll be describing some of these tests in my next slides. So first thing is bronchodilator reversibility. So as I have mentioned earlier, asthma, it is due to the narrowing of the airway. So what we do in this test is we give some bronchodilator to the patient and check whether the narrowing of the airway is reversed or not. Okay, and the next other test we can do is peak expiratory flow variability. So first, let's understand what peak expiratory flow is. It is the maximum speed of expiration. So it is expressed in liter per minute. We have to measure it daily and calculate the difference daily, and we have to measure it for usually 2 weeks. Then we have to average it out over those 2 weeks. Then we have to know we have to express it in mean. Then we'll calculate the peak expiratory flow. Then we will decide. All right. And the next test we do is bronchial challenge test. So As I have mentioned earlier, that it is an allergic reaction. In this bronchial challenge test, what we do is we give some of the bronchoconstrictor. All right. In bronchodilator reversibility test, what we are looking for is we are looking whether the narrowing of the airway is reversed or not. But in bronchial challenge test, what we do is we are looking whether the airway is hyperresponsive or not. So what we do is we give the bronchoconstrictor medication and we increase their dose one by one uh, in a graded manner. Then we check the FEV1 of the patient after each dose, and we will check the FEV1 until the FEV1 falls by a number we have decided before performing a test. So we'll calculate the FEV1 one by one and see how much is the difference, and at what dose of the bronchoconstrictor does the FEV1 fall by a number that we have decided earlier. Okay. And other test we do is skin prick testing. Here we are just looking whether the patient is allergic to a specific allergen or not. We'll introduce a small amount of specific allergen to the patient's skin and see whether the patient developed any reaction or not. Okay, so now there are few algorithm that is made by nice British Thoracic Council and Sign. These are the organization that the health organization over the UK, and they have decided on a common guideline so that for diagnosing in asthma. It is different for different people of different ages. So for the people age, this is for the people aged over 16 and adults. So what we do in this those individuals is the first thing we do is we measure their blood eosinophil count or fractional acyl nitric oxide. If that is positive with the suggestive history of asthma, then we confirm the diagnosis. If this test is not available, we move on bronchodilator reversibility. And if that is positive with the history, then asthma is diagnosed. Then again, we move on. If that is not available, we move on to the next test, and then we move on to the next test. So that is the order in which we conduct our investigation in the patient is over 16 years of age. And if any one of these is positive with the suggestive history of asthma, we can diagnose asthma. All right. And if these tests are not positive, we have to look out for any other alternative diagnosis. Okay. And this is the algorithm for the child is between 5 to 16 years. So the order of the investigation is somewhat similar, but in the child we do eosinophil count at last. We start with fractional acyl nitric oxide, then we move on to bronchodilator reversibility, then peak expiratory flow variability, then we do skin prick test, and we measure total IgE and blood eosinophil. So we don't need to do all of this test. We need to start with the first one, and if that is not available, we'll move on to the next. So if any one of this test is positive with the suggestive history of asthma, we again confirm the diagnosis. If not, we have to look for alternative diagnosis. And these are the algorithms. Okay. So to diagnose asthma in child under the age of 5, it is pretty difficult. So there is no specific test that we can do in child under the age of 5. So what we do in the child under the age of 5 is if there is history suggestive of asthma, what we do is we treat them with corticosteroids and wait for them to reach 5 years of age when we can attempt those objective tests that I have mentioned before. So if the child we cannot perform those tests when they reach 5 year of age, then we can wait until they can. So for child, there is no specific test. What we do is we just treat them with corticosteroids. Okay, so how we can this is how we can diagnose asthma. Some Now moving on to the medication. There are management guideline as well. I am not going to go in detail in those management guidelines. So what I will do is I'll just discuss about some of the medication that we can use in asthma control. By far, the most common medication we use while treating asthma is salbutamol. It is a short-acting beta agonist, and they are also called relievers. In asthma, is we have established that there is narrowing of airway. This salbutamol, what it does is it opens the airway so that patient can breathe easily. So they are short-acting medication and they can be used whenever patient have symptoms of asthma, right? And the other medication that we use is corticosteroids, beclomethasone. They are also called preventer, and these are the medication that patient need to use daily. So what it will do is it will reduce the inflammatory reactions, and it help to prevent the symptoms of asthma in long term. Okay, these are the two medications that are commonly used while managing the patient with asthma. The other medication that we can use is long-acting beta agonist, and other is muscarinic antagonist like tiotropium as well. These all medication, these inhaled corticosteroid, they work by reducing the inflammation of the airway. But these all medication, beta agonist, short-acting beta agonist, long-acting beta agonist, they all work by opening the airway. And muscarinic antagonist, they also work by opening the airway. All right. So when the patient is having an acute attack of asthma, we have to use short-acting medication because long-acting medication they will take time to act. So the most commonly used medication during the acute attack is salbutamol and ipratropium. Ipratropium again, it is a muscarinic antagonist. Right. And the other medication that we can use for the long-term control is anti-allergic medication like leukotriene receptor antagonist, montelukast, and zafirlukast. And these leukotriene receptor antagonists, they are used in late part of the management. First, we use these two medications, short-acting beta agonist and inhaled corticosteroids. And this medication comes later if the asthma is not controlled by these two medication. So I'm not going to go in detail about the management guideline. There are guidelines for people of different age. So, but by far, but the most commonly used medication are these two: salbutamol and beclomethasone. Okay, all right. And now the most important part is to educate patient about asthma management. So, if we don't educate patient about their disease while managing asthma, it can be very difficult to manage those patients. So we need to educate patient about certain things while treating their asthma. We need to let them know about the common triggers, and we need to educate them that they need to find their own triggers so that they can avoid those triggers. And we have to train patient on correct inhaler technique because those medications that I have mentioned earlier, like salbutamol and beclomethasone, they are taken by inhalation. So if that medication does not reach the airway, it does not work. So we have to educate patient on correct inhaler technique. We can show them that we can do by showing some videos or giving them leaflet pamphlets as well, and we can do live demonstration as well. But it is very important for the patient to know the correct inhaler technique. otherwise the medication cannot may not work. And uh, and uh, and if we don't teach them correct inhaler technique, the medication may not reach airway, and it can remain in mouth as well. So if the medication remains in mouth, it can lead to other side effect as well. So it is very important that we make sure that patient know how to use the inhaler technique. And this is very important while treating the patient with young asthma patient, because because they are crying and doing everything. So we need to teach their parents about this correct inhaler technique, and make sure that they know how to use it properly. Right, and the other thing that we need to teach patient is common side effect of the medication. Because if the patient does not know about the side effect, they might panic. If we educate them early about the common side effect of the medication, they will remain calm if they get those side effect. And the side effect, they are very common with those medication. And uh, another thing that we need to teach patient is to maintain their asthma diary. This is to know the status of their asthma, and whether their asthma is controlled or not. And another thing that we need to educate patient is about what to do when they develop asthma symptoms. This is again to make them calm. If they know what to do when they have asthma symptom, they will remain calm. They will become when they develop the asthma symptoms. And to this will help them to uh, he- unnec- this will help them to reduce the unnecessary stress during the time of asthma symptoms. So now I'll be discussing about some of the common side effect of the medication, and how what asthma diary is, and what we need to tell patient when they develop asthma symptoms. Okay. So, as I told earlier, salbutamol and beclomethasone are the most common medication that are used in asthma treatment. So, I'll be discussing about their side effects. So, with salbutamols, the most common side effects are headache, muscle cramps, heart racing, and hand shaking. So we need to educate patient that you can before after prescribing salbutamol, we need to tell patient that you can have these symptoms, so they don't panic when they have these symptoms. So these symptoms, they are not serious. They usually pass within few minutes, and they are not dangerous. But if we don't educate patient about the side effect, they might panic, and that might lead to unnecessary stress. So with beclomethasone, is it is a corticosteroids, so we can have thrush, sore throat, and hoarse voice, and all of these symptoms, these symptoms that can be minimized by correct inhaler technique. Okay, if if the patient is trained to use the inhaler correctly, all of the symptoms, it can be minimized. And the other things that the patient can do why to reduce this side effect is to brush their teeth after using the inhaler. So in most of the scenario, what we tell patient is to keep their toothbrush along with this medication, so that they don't forget to brush their teeth after using beclomethasone. Because beclomethasone, we have the patient have to use daily, and if they forget to brush after using it, it can lead to thrush and other infections. So it's wise to tell the patient to keep the toothbrush alongside this beclomethasone. Okay. Now now I'll show you asthma diary. This is a asthma diary. So here are few signs. There are here. I don't know whether everybody can see it or not, but here you can record the peak expiratory flow, morning and evening peak expiratory flow. And here are few things that patient can tick if they have these things. So here in at the top at the top of this chart you can see the days. So this is Monday, Tuesday, Wednesday, Thursday, and patient, if they have use reliever on that day, they can tick here. And if they have symptoms, they can tick here. And if they wake at night, they can tick here. And and uh, and they can take the peak expiratory flow and record it here. Morning peak expiratory flow they can record in this column, and evening they can record in this column, right? So this asthma diary will help the people involved in the management of asthma, involved in the care of the patient, and the patient to know whether whether the asthma is in control or not. That is the main reason to use it. So yeah, in asthma diary you can record the morning and evening peak expiratory flow reading, and patient can tick the box if they have any of these symptoms. All right. Okay. And the another thing that we need to educate patient about is what to do if they have asthma symptoms. We need to tell them they need to relax and take slow and steady breath, because if symptoms can worsen if patient panics. All right, we have to tell them they can use salbutamol, which is a reliever inhaler. And in UK it comes in blue color, so so we can educate patient that they can take blue inhaler when they have asthma symptoms. These inhaler can be taken every 30 to 60 seconds, all right, and up to the maximum of 10 puffs at one time. And if the patient can always call 999 for an ambulance if their symptoms is not improved by inhaler, or the patient is worried at any point of the time, or the patient feel worse despite using the inhaler, or patient does not feel better even after taking the 10 pops. So we need to tell patient that they can call 999 for an ambulance at any point they are worried. So if the ambulance does not arrive within 15 minutes, they can take the reliever inhaler again. So why it is important to educate patient about this is to prevent any unnecessary stress on the patient. If the patient is stressed during the time of asthma attack, thing can become worse and it will do no good. So if you tell the patient that you can do this and that, you can take reliever medication, you can call ambulance, and if the ambulance does not arrive within 5 minutes, you can take the reliever inhaler. If the patient knows that beforehand, that will help to manage their anxiety. So it will make them feel like they are prepared when they have asthma symptoms. All right. In the management of asthma, we patient education is very very important. If the patient is not compliant with the medication, and if they does not know about the disease, if they does not know about the medication, or if they does not know the correct inhaler technique, or they does not know about the asthma diary, it will be very difficult for the people taking care of them to manage their situation. So we need to educate patient about these things. All right. So that's all for today. So I have noted down all the reference that I have taken for to prepare these slides. I have used NHS websites, a nice guideline, and WHO website to prepare these slides. You can browse whenever you want. So thank you. Thank you all for being a good audience. That's all for today.
Wow. Okay. So thank you, Doctor. Okay. So does anybody have questions? click raise your hand. So if you have any questions. Okay, so I don't think anybody has any questions. So I guess we could have a selfie just um, for a documentation of who has attended. Okay, so we just so if anybody can open their cameras, let me just um, enable opening cameras. There we go. Okay, so anybody should be able to open their cameras now. So if you're able to open your cameras, please do so so we can have a selfie for those who have attended. Okay, all right. I guess that's it. Okay. Okay, there's Anjan. Um, okay, yeah. So 3, 2, 1. Cheese. Nice. Okay, so thank you for coming, everyone. I hope you come in on our next or upcoming webinars. Oh, okay. So Judy has opened her camera. So okay, so let's take another selfie again with Judy this time. Okay, so 3, 2, 1. Cheese. There we go. Okay, so as I was saying, thank you for coming, everyone. I hope you come again on our future webinars. So, yeah, Ma'am Windell, do you have anything to say before we close the webinar?
Thank you very much, Doki. I always call him Doki. So, for those of you who have attended, may I request that you send us your full name because we will be sending you certificates after this, so that at least you can, use it for your professional development portfolios, especially if you have a registration to the NMC, GMC, or any type of healthcare registration in the UK, you will be needing a certificate as part of your professional development. And not only that as well, if, for example, you wanted to monitor your progress, you really need the certificate as well as part of your personal development. So thank you very much, Dr. Saksham, and I hope we could invite you once again for the next topic if you are available. Just let us know your availability and the topic again, and then we will do it again for you. Thank you very much. Thank you very much, guys. Thank you, everyone.
Thank you. Bye.
Bye bye.